A psychiatrist is a doctor who is trained to diagnose and treat mental health problems. I have specialized in the psychiatry of adults with learning disabilities, and that means that we look after people who may have a developmental condition, they may have a learning disability, or they may have autism, but in addition they have developed mental health problems. A problem with a person's cognitive abilities. And that may mean a memory problem, that may mean a comprehension problem, or the way people make judgments, or they use their speech. The other condition that has to be met to say that a person has a learning disability is that that cognitive problem has to affect their day-to-day life. So there are people who have mild learning disabilities, but they get on quite well. They have a job, they have a family, they live okay. The difficulty is when the learning disability affects the ability to work, to form relationships, to study, and so on. And the third condition is that to name this group of problems a learning disability, there has to be evidence that they started early in life. And the difference is a person with dementia, for example, may fit the description, the earlier description, but their brain was working okay before they developed dementia. A learning disability is something that happens either at birth or during childhood. ADHD is a condition that affects our ability to concentrate on tasks that require a degree of concentration, such as studying or doing detailed work. It usually presents as a chronic problem, and the person may otherwise have normal intelligence, may have lots of other skills, but this is a specific problem of attention. And usually it comes with problems like impulsivity, acting without thinking much, being quite hyperactive in the sense that the person feeling restless, the child find it very difficult to stay for long enough in a particular task, jumping from one thing to the other. Fairly common condition, and of course it has varying degrees of severity. So some people may have a little bit of ADHD and they cope okay with that. For a much smaller number of children and adults is a severe problem in the way that it seriously affects their chances of education, it does affect their work, relationships, and so on. Anxiety disorders are at least 50% of people with ADHD have also anxiety. Depression is quite common, as it is problems with substance use, alcohol or drugs. First, identifying the problem, because a lot of people may go on in life for years and years without realizing that it's not their fault entirely what is happening in terms of organization or general success. And our role is to identify this problem, say that it is likely to be present or it isn't, because a lot of people may think that they have ADHD, but in fact they don't. And to suggest ways to improve these difficulties. There has been an increased number of diagnosis of ADHD in children. And that is a concern. We hear people say, there's so much ADHD in children. Is this possible? We keep hearing that it's 5%, now it's 10%. And there's a genuine concern that it has been overdiagnosed because it has become popular and it can be seen as an explanation for other problems sometimes. And rightly so, there is a debate about that. But I think this is a very small part of the whole picture. The whole picture is that the majority of, for example, adults with ADHD, the vast majority of adults with ADHD never get diagnosed. And the same goes for children. There may be a subgroup of children in particular areas or in particular countries that tend to be overdiagnosed, but globally, if we look, the picture is that most children and adults with ADHD will never be diagnosed. The more thorough your approach is, the greater the chance of getting it right. Because traditionally, the diagnosis has been based on reports, on the way people report a child's behavior or their problems. There is a degree of subjectivity there that in medicine we don't feel comfortable making a diagnosis just based on reports of what people say. So to increase the accuracy of diagnosis, to make sure that someone has it or hasn't got it, and that's very important, because if you get it wrong and someone has ADHD and you missed it, they probably miss out on opportunities to improve a lot of their difficulties. If they haven't got it and through a very hasty assessment you say, oh yes, they've got ADHD, that means that they may take medication they don't need for a long time, and they may not find the real root, the real cause of their problems. We use reports of what people say, whether the stories we hear, they make sense, they're sort of typical of a person with ADHD. Then we use some questionnaires that have been studied and have been found to pick up ADHD with quite high rate of success. They have been properly validated, as we say. And lately we also have the help of technology. We use some new technology, which is basically a computer test that measures your attention, aspects of your attention objectively. It also measures how much you move during the test, which is something that we haven't been paying attention to, is the hyperactivity element. And all these information combined from multiple sources. For example, I would want to hear what parents say, what teachers say, and what the child says. So we try to have information from multiple sources, plus the objective testing. All that combined can give us a good degree of confidence that ADHD is a problem. Autism would describe a group of conditions that present with certain features early in life. The most common features of autism would be difficulties in social communication. And by that we mean not just language, but also the non-verbal communication, gestures, eye contact, behaviors and skills that most children develop naturally, such as greeting people, looking them in the eyes, taking part in conversations or early forms of it, does not happen naturally in autism. We see some practical difficulties in communicating, both because of the language barrier and the non-verbal communication barrier. And another common feature is a tendency for people with autism to prefer routines, to prefer doing the same thing over and over again. And that can be sometimes problematic in the sense that it interferes with everyday activities. The need to repeat certain acts or certain movements can interfere with either the person's ability to communicate or to be safe. About 1/3 of people with autism also have cognitive challenges, also have a learning disability. But that means that 2/3 have normal or above normal intelligence, which may not show because of the difficulties in social communication. So if we want to summarize it, put it simply, I would say difficulties with language, difficulties with non-verbal communication, and by that we mean gestures, eye contact, body posture, and a tendency for repetitive behaviors. About 20 years of genetics research in autism and ADHD, and still we haven't got a conclusive answer that, this is the gene for autism. Several genes have been identified to be more common in people who develop autism, and several subtypes of autism, at least 40 in the latest research I've been reading, 40 subtypes of autism can be identified through genetic testing. But yet we haven't got a test to do and say, oh, you've got this DNA profile, so you have autism. Perhaps 1% or 2% of all cases can be explained at the moment genetically. Epigenetics means changes in the DNA that happen after birth. And most research concentrates on how these epigenetic changes lead to a breakdown of normal development, if you like, and the development of autism. So that means that a person may have some genes that make them more susceptible. There is emerging evidence for the possible toxicity of certain substances that they are in the environment. There is some suggestion that autism is in fact an immunological disorder. There is quite strong evidence that if you have autism, you have a number of other medical problems, for example, gastrointestinal problems, allergies, eczema, asthma are all more common in autism. And I think we are seeing more and more pieces of the puzzle being completed. For many people, autism does not mean disability. It may mean that they have different abilities, they may have different habits, is what we would, in the past, would call eccentricity, if you like. But we should not see this, shouldn't see these traits as unhelpful or, sort of pathological. So, for many people with autism, just the understanding of their condition is enough for them to get on in life and succeed. And we do know that some people have exceptional abilities. They have autism, but at the same time they have unique abilities. Not all of them, this is the exception rather than the rule. But there is a significant group of people with autism that are going to need support for life, 24/7. And that is a concern, that this group with the more severe conditions, they tend to have also medical problems, they tend to have very poor nutrition, they tend to have very unhealthy lifestyles. And we want to concentrate our efforts to target this group. I'd say it's central because we can't have health without mental health. Again, it's good to separate between the more severe mental health problems, the type of problems that render a person incapable of work, for example. If you have a severe mental illness like severe schizophrenia with frequent hospitalizations, it's quite hard to sustain a job, it's quite hard to look after your family. So this group of severe mental illness is obviously more rare, but requires a lot of support. So they may have problems with anxiety, depression, stress, obsessive thinking, or problems with addictions. Though these problems are not severe enough for the person to end up in hospital or to be unable to work, they do have a great cost, both in terms of loss of personal enjoyment and loss of opportunity. It's a huge financial burden because it leads to absence from work, reduced productivity, increased need for care. They can lead to secondary problems. So if someone suffers from depression or anxiety and they don't get any better, they may start drinking to cope with the difficult problems. Or there's a sort of vicious circle of poor mental health leading to poor lifestyle choices, which leads to a worsening of physical health, and in response, mental health also deteriorates. The role of diet in mental health is a very hot topic at the moment in psychiatry. And I think generally in medicine, in traditional medicine, we have taken an approach where we wouldn't discuss lifestyle factors as much. Yes, we always give the usual advice, avoid certain types of food. People know what is healthy eating in a sense, but medicine has not embraced, if you like, the potential benefits of the right nutrition for certain conditions. And this is because we haven't had the evidence from studies, at least to the extent that we have for prescribed medication. But thanks to a renewed interest in healthy living, I think it's now at least 20 years that people return to the question, how does diet affect our health? How is exercise affect our mental health? That we have some studies, and increasingly of good quality, that demonstrates a link between diet, physical health, mental health. We know if we have a heavy meal full of carbohydrates, you're more likely to feel a bit sleepy, less alert. So there's an instant impact on your cognitive functions there and then. But we know also long-term, certain diets lead to very poor outcomes for brain health. Obviously, a high sugar intake can lead to the development of obesity and diabetes, and we know that both obesity and diabetes affect mental health. It's quite clear that can lead to depression. It makes sense to people. There's possibly both a psychological component. The person feels bad because they've put on weight and they feel unable to control their cravings for food, for highly calorific food, sugar. So self-esteem eventually will be affected. But also it is possible that there is a more toxic effect of inflammation caused by certain types of diet, neuroinflammation, that has just started to be taken seriously. Almost a triple risk by poor diet: the immediate effect on mood, the cravings, the up and downs, the long-term effect of obesity or diabetes psychologically and on health, and possibly some link between brain conditions, Alzheimer's, and poor diet. The relationship of sleep to ADHD, autism, neurodevelopmental conditions, but also general mental health problems such as anxiety disorders or depression is a very close one. I would say there isn't really any mental health condition that doesn't affect sleep one way or another. We know that sleep is absolutely necessary for the brain to stay healthy. We know that even missing 1 hour of your usual sleep pattern shows up in cognitive testing. And if you stay one night without sleep at all, your cognitive testing is at the level of someone who is over the legal alcohol level for driving. So you can be as impaired as someone who is very drunk if you haven't slept at all. And that shows up when you have to do more kind of fine work, operate machinery. So it's a huge public health concern, people not sleeping enough and then being asked to do complex activities or work. There's a two-way relationship between sleep and psychiatric disorder. We know that lack of sleep can lead to psychiatric disorder. We know that sleep deprivation is a form of torture. If you stay long without sleep at all, you can have hallucinations, you can have panic attacks, and at the same time there are mental health problems that one of their symptoms is sleep difficulties, and it could be difficulty falling asleep, difficulty staying asleep, your sleep being broken. It's a very complex relationship. Sleep is also can be affected by physical health, by breathing disorders. A lot of sleep problems have to do with people not breathing properly. And we know that the environment is also very important for good quality sleep. The atmosphere, the bed, the temperature. The relationship of stress and mental health is the same as sleep, is very much linked. Stress can be a symptom of mental illness in the absence of any real stress factors in life. So a person can develop a mental illness without being stressed particularly about something, and as a symptom they may present with anxiety. On the other hand, a healthy person who faces real stress at work, at family, in other societies because of war or poverty, that ongoing stress leads to mental health problems. It's well documented. Acute and extreme stress can cause post-traumatic stress disorder. It's a very serious condition. But we also know that even mild stress, if it is repetitive and prolonged, it is associated with very poor outcomes, both in physical and mental health. So yes, stress, either very acute and very unusual, or common but ongoing, are harmful. Is there a link between microbiome and brain health? My view is quite possibly yes. There is an anatomical link. There's the gut-brain axis. So there's actual tissue linking the brain with our bowels, nerves, and it is possible that the environment in the bowels depends on the type of germs that actually live there, which in turn affects the absorption of certain nutrients or vitamins. There is also suggestion that certain germs produce chemicals that can act as signals to the brain, for example, to increase appetite. There's an intriguing suggestion that certain germs that thrive on sugar, for example, create chemicals that give the signal to the brain to crave for sugar. This is as if they have taken over, and this is fascinating, but there is scientific basis in these claims, and I think it's time for doctors to look into that with less prejudice. The effect of lack of vitamins on the brain has been well documented from the time that people were traveling with boats across the world, and they realized that if they don't have certain fruits like citrus fruits, they develop scurvy. And if you look at the descriptions of the psychiatric or the neurological symptoms of these lack of vitamins, you recognize sort of symptoms we see in mental illnesses or dementia or other conditions, which is the clear evidence that vitamins are necessary for a healthy brain. Vitamin B complex is well known to being very important, especially when people have chronic alcohol problems. They are given by their GPs a vitamin B complex to prevent very significant neurological problems. We now look into whether the vitamins that people take as supplements actually make it to the site of interest. We know that the brain is protected by the blood barrier, of the brain-blood barrier, as it is known, and not everything that we take on is able to go through this barrier. For obvious reasons, the brain needs to be well protected. So there's interest in how certain molecules can cross this brain barrier, and how sometimes what we measure through a blood test may not reflect what is happening in the brain. Several studies, especially in Scandinavia, where they have these really detailed case records from the time someone is born until their death. They do take statistics, and we look at these registers for population statistics, and there's almost a very strong suggestion that when pregnant women don't take enough folic acid, that increases the risk of autism. To have good physical health first. The brain depends on the body to get its oxygen, its nutrients. So we've got to have a healthy body, and by that I mean exercise is without question one of the simplest forms of doing something to improve both your physical and mental health. We know that exercise improves attention levels, improves mood, gives a sense of relaxation, and the main difficulty is, people know that it's a good thing for them, but how do you affect the lifestyle change? How do you help people find the motivation to make exercise part of the daily life? So this is the big challenge. It's not so much that people don't know what's good for them, is making this advice work for them, helping them take up health interventions, lifestyle changes. And I think one thing is to be really convinced that this is now backed by science. It's not just a good thing for you to do. You will live longer, you will have a better quality of life if you exercise regularly. So that message, I think, needs to be very clear. And then it's down to the health service as a whole to facilitate people living healthier lifestyles. It's just not good enough to give the advice, and then that person that has problems with obesity or stress or sleep difficulties, they go back to an environment and in a situation where they cannot actually practice this advice because they can't access a gym or because they can't access healthy, nutritious food. So that needs to be taken into account as well. A lot of natural treatments or sort of focus on nutrition and lifestyle has not had the attention from the medical community because of the lack of rigorous scientific studies backing these claims. But my view is that very low risk interventions that have the potential to help should be given equal weight.